Have you ever been studying for an exam and felt like this?
Please help me.
If so, you've come to the right place. Dr. Perkins is here to help you. With tips and explanations that will not just help you learn the information, but master it for years to come. Alright guys, today we're going to be talking about penicillins. So, how do you know if you have a penicillin? Think of cillin to get the villain. And the villain is going to be gram-positive bacteria. So amoxicillin is the most commonly prescribed penicillin. And so that's the drug we're going to be talking about today. And we're going to be using that as kind of a guide to let us know what most of penicillins are going to do. So how was penicillin discovered? It was discovered when a lab tech went on vacation, of all things. So he went on vacation, had a great time, and when he came back, he noticed that a lot of his plates had mold on them. And the plates that had mold on them, the bacteria wouldn't grow next to the mold. He said, I bet there's a substance that this mold is making that's stopping the bacteria from growing. And sure enough, that was penicillin. So what do we use penicillins for, or beta-lactams? So we use these to treat gram-positive infection. I'll talk about that on the next slide, why gram-positive. But it's going to deal with septicemia, that's a life-threatening infection. It's going to deal with empyema. And so what happens is when you get a bad case of pneumonia, it can actually get out of the lung, and you get a pus pocket between the lung and the chest wall. And that's called empyema. No surprise, it's going to treat pneumonia. All right, pericarditis. So the heart's inside of a sac, and that's keeping the heart from rubbing up against blood vessels. Well, sometimes the gap between the heart and that sac will get infected, or the heart sac itself will get infected. So pericarditis, endocarditis. So this is the part of the heart that makes your valves, and so that's going to open and close, allow blood just to flow one way through the heart. Well, if those get infected, you can very rapidly die. And meningitis. So your brain has saran wrap, 3 layers of saran wrap, and if these get infected, they can very rapidly prove fatal. And so you see a lot of these infections that penicillin is used for are very deadly. And so now we're going to talk about why gram-positive bacteria. Alright, so we're constantly being exposed to bacteria. Now bacteria come in 2 flavors, gram-positive and gram-negative. We'll deal with the gram-negative and then we'll focus on the gram-positive. So gram-negative have 2 cell membranes. So they got an outer cell membrane and an inner cell membrane, right? And so what's between these 2 is the cell wall here. And so it's going to protect that cell wall with that outer cell membrane. Now gram-positive just has 1 cell membrane. And so the wall is on top of that cell membrane. The problem in terms of the bacteria with that is that cell wall is now exposed. Well, why do the bacteria need cell walls in the first place? Well, what happens is you can see there's a bunch of stuff dissolved in the liquid of this cell. And so if you remember osmosis, what happens? Water wants to go from a place where there's not a lot of stuff dissolved into it to stuff where there is a lot of stuff dissolved in it. So water's going to flow into this cell, right? And so think of that cell as kind of like a balloon. If I blow up my balloon, right, it's going to get bigger, bigger, and bigger. And eventually it's going to pop, right? Well, the bacteria doesn't want that to happen, so it has a cell wall, all right? And that's going to stop the balloon from popping. Now, what we use is a beta-lactam, right? So particularly penicillin, right? And so what penicillin does is it stops the cell wall from being able to be formed. And as a result, the cell is going to fall apart, just like this. Now for the bacteria, that is not a good idea. But for us, that's an excellent idea. That's exactly what would have happened. And just like that wall fell apart very quickly, the bacteria's walls are going to fall apart quickly. And so the bacteria are just going to start popping, exploding left and right. And very quickly, the person's going to get better. Matter of fact, it had such quick turnaround when these drugs first came out, we called it the Lazarus effect. What on earth are they talking about? Well, if you look in the Bible, Jesus goes to the tomb where his friend Lazarus had been dead for 4 days. And he says, Lazarus, come forth. And the man comes out of the grave after being dead for 4 days. That's what they liken to these drugs to. Oh my goodness, it's a miracle. This patient I thought would never survive. There's no way he's going to make it. We give him penicillin. Oh my goodness, next day he's sitting up in bed. Hey, when can I go home? I feel great. Right? So very powerful drugs. Now, unfortunately today, they're not that amazing because we have antibiotic resistance. So for the sake of simplicity, we're just going to be talking about adult dosing, right? Why? Because kids dosing, it's based off weight, so you're going to have a way bigger range based off of how much the kid weighs and so on. Anyways, just for an adult dosing, anywhere from 750 milligrams per day all the way up to 3,000 milligrams per day. And so as you can see, this is pretty well tolerated across those ranges. And that dosing is going to all be orally for amoxicillin, and it's going to be based off of what you're taking it for. How easy of a time does this drug have of getting to the bug? Other things is how sensitive is the bug to the drug? And how important is it for us to kill the bug? Alright, so side effects and adverse reactions. So, remember how penicillin works by killing bacteria? It breaks down that cell wall. So any bacteria that is gram-positive and does not protect its cell wall, just like gram-positive bacteria don't, that cell wall is going to fall apart. Well, our GI system has lots of bacteria in it that are gram-positive. And so you start killing these bacteria in wide numbers, what are you going to get? You're going to get nausea, abdominal pain, maybe even some vomiting and diarrhea, right? And so, needless to say, lots of side effects. Why? We actually have more bacteria in our body in terms of number of cells than which we have human cells. When you poop, half of what ends up in the toilet is the bacteria. And so if you're killing normal healthy bacteria, of course you're going to have a lot of these side effects here. Now, some of these side effects also can be explained in terms of an allergic reaction. So, unfortunately, a good chunk of people are allergic to penicillin. And so, I take this, I'm having anaphylaxis. This is a life-threatening allergic reaction. And so my throat closes. I can't breathe. Right? You can get skin rashes. You can get abdominal pain, nausea, vomiting, diarrhea can all be a side effect of having a life-threatening allergic reaction. And here's a good picture of what that rash is going to look like if you're taking penicillin. Now, one thing also to be aware of, if you have a person come in with a sore throat or they have swollen glands and fever, be aware they might actually have mono. Why is this important? Because if you give somebody with mono amoxicillin, they're going to get a skin rash. It's almost a guaranteed thing. And now you're listing them as being allergic to penicillin when really they're not. So very important to be aware of that. So now we're talking about precautions. Emergency, watch out, right? We don't want emergencies happening, right? And so we got to take these precautions seriously. It's just like doing Jenga, right? I'm trying to take out this piece, and if I'm not careful, this whole thing's going to fall down, right? This might be the piece that won you the game, but if you do it wrong, you just lost the game. Same idea here with the precautions. All right, high dosage. You got a patient very sick. You're giving them a lot of penicillin, or in this case, amoxicillin. What happens? You're killing off all the bacteria that this antibiotic can work on. And this antibiotic is great. It covers lots of different bacteria. which makes it really simple, right? Look, is it gram-positive? Excellent, this will probably work on it. But the problem is I'm killing a lot of bacteria I don't need to kill. And so what will happen is the few bacteria that are left, aka the gram-negative bacteria, now they could go hog wild, right? I'm not having to fight with all these different bugs that normally live in the intestines. And so now you're getting deathly ill and can die. C. diff is a huge cause of death because you run out of antibiotic, you killed off all the bacteria that you could kill off with that antibiotic. Now the C. diff goes hog wild. Okay, also another thing to be aware of with penicillin in particular is it often comes in IV form that has potassium in it. And so if I'm getting IV potassium and you're giving me a lot of that, it can literally stop my heart, right? And so yeah, you definitely want to go slower with that. Give the kidneys time to pee out that surplus potassium and everything else. All right, other things to be careful about is if I have a serious allergies or asthma, right? Why? Because we already know a lot of people are allergic to penicillin. If you have serious allergies or asthma, you're kind of leaning more towards getting those serious allergic reactions. So we gotta be very careful with you, right? We might want to try a different drug that's less likely to have an allergic reaction. Lastly is that GFR under 30 milliliters per minute, right? Why do we care about this? Well, this is how fast your kidneys are cleaning your blood. And the reason why we care is the way you get rid of penicillins is you pee them out. And so if it's taking your body a long time to pee them out, or the breakdown products of penicillin as well, you're more likely to have bad things happen to you. And so we got to be way more careful about this. All right, so contraindications. These are things where you want to have that Gandalf moment, right? You shall not pass. All right, why? Because this can kill the person. So history of anaphylaxis to penicillin or its derivatives, we're not going to kill this person, not today, right? You got to get allergy on board to make sure that's not a real allergy. And if it is, then they got to be desensitized. But as long as they're sensitized, once again, Gandalf moment. You shall not pass. Why? Because you're going to kill that person. History of corn allergies, right? If you're doing a sugar sweetened thing, right, the dextrose that they're using to sweeten that solution often comes from corn. And so if they're allergic to corn, it can literally kill them. So nursing interventions. All right, you're going to be just like the CIA. All right, and so what are you watching for? We're watching for C. diff. How do you know they have C. diff? A lot of times they'll have a smell to it. And so older, more experienced nurses will say, hey, they have kind of like a C. diffy smell here. Another thing you're going to see is blood in the stool. You're going to see the white blood cell count going up. They're starting to get fevers, right? That's going to bring me to my next point, infections, right? Why? Because I've killed off all the helpful bacteria. We're only left with the bad ones. And so now all of a sudden their sputum's changing color, their urine's changing color. As I said, the stool's changing color, or you're seeing an increased white blood cell count, and of course anaphylaxis, those life-threatening allergic reactions. They can't breathe, their heart rate starts racing, their respiratory rate goes up, their oxygen level drops. Right, so you're going to watch these patients just like that CIA. All right, patient education. Last but not least, we want our patients to finish the course. Right? So here's the problem. Patients, they want to save money. Who doesn't, right? So the doctor gives them a 10-day script, and by day 5, man, I feel better. I'm ready to go home. I'm ready to get on with my life. I don't need to take the rest of these pills. I'm going to save these pills. So if I ever do get sick again, a year, 5 years, 10 years down the line, I don't have to run back to the doctor and spend all that money. Here's the problem. Why did you go to the doctor in the first place? Because you had these bugs rapidly growing inside of you that your immune system couldn't fight off effectively. Alright, if you stop taking those antibiotics, those bugs will start growing rapidly again, and it will land you back at the doctor's office, the emergency room, the hospital, and hopefully not the graveyard. Unfortunately, that has happened. Patients have died because they stopped taking their pills. Alright, so the other thing you're going to have them reach out to is if they get signs and symptoms of C. diff. What are the signs and symptoms of C. diff? Diarrhea, abdominal pain, fever, and bloody stools. Okay, here's where the hard sell comes at. Don't take a medication that stops diarrhea. Why? I don't want to poop myself. That'd be embarrassing, right? Well, here's the problem. All right, why are we having diarrhea? Part of it is clearing out the large intestine. That's a wonderful thing. So if you have a bacteria, C. diff, that's literally rotting your large intestine, I don't want that poison to stay in my large intestine and rot it. I want to poop that poison out so my large intestine doesn't get damaged. A big problem with taking those anti-diarrhea is you're allowing that poison just attack the colon, and now you gotta get a colectomy, right? We're taking out a chunk of your large intestine, and now you might be dealing with a colostomy bag for the rest of your life. That can and does happen. So big deal, you gotta tell us right away so you don't end up with a colostomy bag or worse. So very important teaching point.